I'm Katie LaGrone. If you've been to your doctor's office lately, you may want to double check your bill. That's because more patients are getting hit with surprise fees you don't typically get unless you end up in the hospital. Mark and Victoria Hubert like to plan ahead. Their health care, no exception.
My family has a history of some neurological issues, and it takes a long time if you need a doctor to get established as a new patient. So I kind of just went preemptively.
Mark's insurance company referred him to a neurologist near his home, the same doctor his wife went to last year.
I've been to this doctor twice, so we were both floored by this.
Floored because after what Mark describes as just a routine new patient exam at the doctor's office, his explanation of benefits shows he was charged an extra $174 in so-called miscellaneous charges.
I figured there had to be some mistake.
She asked me, what did you do? What happened? And I reiterated the standard, went in to see the doctor, paid the copay, and came out. There was no testing. There was no leaving his office. There was no lab work. There was no other interaction with anyone else.
So Victoria did some digging and discovered that miscellaneous charge is actually a facility fee, a charge that's typically reserved for hospital services.
I said, this doesn't make any sense. It was a regular doctor's appointment.
Mark's neurologist is affiliated with Cleveland Clinic and his office located inside this Cleveland Clinic building, making patients now subject to what the office calls provider-based billing.
It's just not right.
But it's not illegal and becoming increasingly common, explains Dr. Jay Wolfson, a professor and senior associate vice president at USF's College of Public Health.
Kind of like an overhead fee that the hospital is able to glom on. I'm relying on this larger healthcare institution to help me manage my practice, or to in fact manage all my practice. And they may be paying all the salaries for my nurses and my medical assistants and my backroom people, and they've got all the software and the hardware that manages the billing and the finance systems.
Is this new?
No, it's been around for quite a while. In fact, it's been used in Medicare for many years.
But it is expanding as more hospital groups acquire independent doctors' offices. It's estimated about 75% of U.S. doctors are now employed by corporations, according to the Physicians Advocacy Institute. According to Cleveland Clinic, provider-based billing is a Medicare classification. That means hospitals have met certain regulations. So its doctors' offices are now classified as outpatient departments and subject to an extra professional and facility fee, even if a patient has never stepped foot in the hospital.
Never seen something like this before.
Mark and Victoria Hubert are appealing the facility fee and the additional $17 doctor charge that was also tacked on to this provider-based bill. The Huberts believe puts the provider over the patient.
It wasn't a devastating amount of cost. It was just unexpected, unclear, and we were just surprised by it.
How insurance companies cover these extra charges varies depending on your coverage. I'm My Team investigator Katie LaGrone taking action for you.